Well, it is lovely to have your company. We really are spoilt for our health specialists that we have on the show. Doctors, professors, surgeons, dietitians. We have naturopaths and nutritionists. And we always say, go and pursue, talk further with these health professionals and live a better life. But what do they each do? Well, luckily, we have our favourite nutritionist in Sarah Di Lorenzo. Ciao.
Hi, Ed. How are you?
Good. We often say, just have a look at your website, sdlmethod.com. Go and get, a consult. What actually happens in a consult with you as a nutritionist? Because I'm sure it's a bit of a grey area for most listeners.
A lot of people don't quite understand what a nutritionist does, and a lot of people generally think that it could be just chatting about food and maybe just setting a diet. But there is a nutritional consultation is extensive. For starters, it goes for an hour and a half. So the first probably 45 minutes of the consultation will be me taking an interview. And when I take the interview, it's an extensive interview process. I do a physical examination as well as I'll do testing within the clinic. And at the end of the consultation, which is probably the last 5 to 10 minutes roughly of the consultation, you'll walk away with a treatment plan. But really, the nutritional consultation is, it does actually start for me in the waiting room. As soon as I see someone in a waiting room, I will look at them and I'll look at if they're fidgeting, if they're sweating, what their gait is, their mood. I start my visual diagnosis at that point. So it is really extensive and they're very complex. And for me, as a clinical nutritionist, to get people to the goal they want, if it's anything from reversing diabetes to weight loss, treating fatigue, I treat people holistically. So for me, it's absolutely covering body systems, it's covering lifestyle choices, family history. It's quite extensive. And to get that, that's why that initial consultation is really that length of time.
I don't believe I've ever been assessed for fidgeting. So
you can just see that for me, I would pick up nerves. And for me, when I look at nerves, I will instantly think, if I see someone and I think they're nervous, I'll think B vitamin deficiency. If I see someone who's got a sweaty forehead, I might think vitamin D deficiency. There's so many factors about behaviour and about people that you can just look at on a visual diagnostic level to actually try and actually get your diagnosis and get them in the best possible treatment plan that you can give them.
It's been amazing the last few years with the diagnostic power of blood samples and what we can get via, either DNA or just, screening for various things without coughing up blood and fidgeting too much. What other diagnostic tools do you go for?
Okay, so I always ask people to first of all bring in any blood records they've got. I don't insist that they bring them in, but it is great for me if I'm looking at writing that treatment plan. It's fantastic for me to actually have that there just to help if there's any deficiencies that I can see, or look at their lipids or look at their thyroid. So it gives me a greater understanding, and it will really help me cut back and get to a treatment plan easier as opposed to organising it. But diagnostics within the clinic in the treatment process.
By the way, I should mention you gave me that zinc test last week, right?
Yes.
I just had metal mouth. And then after you, we had these baristas in to do this coffee smelling and tasting test.
Yeah.
I just flunked everything, Sarah, because I couldn't taste or smell anything.
Do you think it was still... But that's a good indication that you're super healthy.
Yeah, but I just wasted an afternoon of sampling beautiful coffees. I couldn't taste a single thing.
But the reward is you now know that you know you're super healthy. You know that you've got great zinc levels.
They just looked at me like I was a completely unresponsive vegetable. And
is that how long the taste lingered?
Well, I had to smell some sort of lemon-scented things and cinnamony kind of things and all the aromas that can crop up within a nice coffee bean. And Chef Daniel's there just naming flavours off the top of his tongue, and I'm like, it tastes like paper.
Oh, I'm sorry.
So I'm pleading. I had this zinc test. It was disgusting. So we can do zinc to show what we're reacting to. What other diagnostic tools
Okay, so the things I use within that first consultation, I will definitely do someone's waist circumference, which is I look for men, I want to be under 94 centimetres. For women, I want them under 80 centimetres. For that, I'm looking for visceral fat. That's the fat around the organs. So that's one thing. The other one I will do is a body composition. So when I do that body composition, I put someone on a scale, and that will read out their fat percentage, their hydration. It will read out bone density, visceral fat, muscle percentage. So it looks at it gives a basic body composition. The other one I'll definitely do, I'll look at the body mass index, but I'll also look at someone's blood pressure.
Okay.
And of course, the one I love doing is Iridology. And Iridology is a fantastic diagnostic tool. I love it.
Tell us about this. I've only had it done the once, and it must have been 20 years ago or something. Look, it's a fascinating window into your body, isn't it?
Okay, so some practitioners use it, some don't, but I find it incredibly effective for so many things. I mean, iridology is the study of the iris, but I look at things like, even if I look at the sclera, which is the white part of the eye, I can pick if someone's got varicose veins. When I look I look at their pupil size, which can show me a lot about different foods that they can eat. It can show me if there's a dominance of their parasympathetic nervous system. I'll look at the size of their autonomic nerve wreath, which will let me know if they're people who are more inclined to eating breakfast, lunch and dinner, as opposed to having breakfast or 5 to 6 snacks a day. I'll look at the structure of the fibres, which will tell me about their personality. Yeah. I can look at their compliance. One thing I love about it is I will pick up personality characteristics. So I will know, because I do life coaching a bit in my consultations. Mm-hmm. And for me, as I said, I treat people holistically. Because of that factor, iridology will give me an idea of their personality characteristics as well as how they will respond to treatment plans, how they recuperate. I will look at their lymphatic system, cardiovascular system. I'll look if they're healing. I can see if they've got parasites. I can see if they've got any hormonal issues. Yes, okay. It's called a radicularis. It's a little sign. I can see calcium lines. There's a lot I can see. So I have my torch in here. Yeah. Now, do you want to do a mini iridology reading?
No, I mean, yes. No. How many little segments is the eye divided into? Because 7. You're looking at different...
There's different bands, but I look at there's all different bands which have up to different regions.
How can you define someone's personality traits from a section in their eye?
It's not. It's more where the fibres are. So there's different. That's their constitution. So you break their constitution. So people who are really strong-willed and they're very rigid and they're very yes/no dogmatic kind of a person. Yeah. They've got very tight fibres in their iris. Mm-hmm. So I would call them a silk constitution. So you relate the iris fibres to fabric. So I know that if someone comes in and I know they're hardworking, I know they're a perfectionist, I know they're compliant, I know they're going to get a program and they're going to execute it because they're very methodical, organised people. I also know, I know that they'll recuperate really well. Whereas so then you'll move into a cotton constitution, which is someone who is a little bit less than that, and that will move down to sort of Hessian, where you look at people's iris fibres, and they're these really emotional people. So they're people who are sensitive and they're emotional. So
balls, good on them. I
will understand with them when I look in their eyes. I will understand that they needed me to treat them and to get them to where I want to get them in their treatment plan, in their goals. Okay. I have to approach them differently.
If I've got parasites, can you not tell everyone?
I won't tell anyone.
It's the strangest thing straight up.
It would just mean you'd need some Convantrin maybe.
The parasites in your eye?
No, just in the gut.
Oh,
in the body.
Lordy.
Yeah.
Okay.
Yes.
Fascinating workup of info, and then from there, it's quite a comprehensive consult.
It's massively, it's hugely comprehensive. I mean, the other things I look for so that's some testing I do. If I feel at the end of the consultation a person needs further testing, I will send them for it, and that will be things like hair mineral testing. It will be stool testing. It will be food intolerance testing, etc. Hormones. It will be adrenals. So I will actually do more functional pathology if I feel that person needs it, or if I really feel I need them to do some blood work. I'll kind of insist on that. But the other things I look for is in my physical examination. So this is sort of
if you reach for the rubber gloves. Seriously, the interview's over.
I'm not. No, okay. I'll always ask permission. But my physical examination is basically I look at their teeth. I'll look at nails. So I look for things like white little spots on the fingernails, which will indicate zinc deficiency.
We're good there, everybody. We're good there.
Clubbing nails will indicate things like AIDS or cardiovascular disease. Spooning nails, brittle nails will be zinc deficiency. Then going on to hair, thinning hair, which is hormones, dull hair, which is protein, dandruff, which is essential fatty acids, brittle hair, again, zinc, breath. I look at people's breath. I don't look at it. I just will always be aware of it, and it can be halitosis or it can be that fruity ketosis breath. This is a big one, Ed, is the tongue. Whenever I ask them to do a tongue analysis, there's two things people in these consultations get nervous talking about.
Well, it's the first consult too. You're not going to be at your peak.
Well,
you're the before shot with this consult, so it's quite nerve-wracking, I should imagine, for all clients.
I always start my consultations with, I put all of my patients at ease. Every nutritional consultation is absolutely confidential. I do expect complete honesty for it to be able to be effective. But yeah, I look at, talking about tongue, people don't want to show me their tongue. So I'm like, and then and it's also talking about stool. When I ask them about gastrointestinal tract, people get uncomfortable about that too.
Rightly so.
Eyes, face, bumps on the back of the arms. I'll look at ears. I'll look at lots of things when I'm looking at when I'm sitting opposite someone.
Sexy times, everybody. But this is necessary just to get back to optimal health. It's worth it, right?
It's absolutely worth it.
All right.
It is.
So you've got your little torch there. You're going to have a shine into my eyes and assess all these things, and we'll report back to you parasite-free. Why don't we do that after this break? If you've got any questions about this sort of testing, this is what a nutritionist does, a really good, thorough clinical nutritionist in your initial consult, and Sarah's one of those. If you'd like to find out a bit more, give us a buzz. We can talk you through it while I'm being probed and assessed for various sort of bugs and stuff. 13 12 83 is our number here. Sarah's here over the break, and if you'd like to find out a little bit more, get yourself in the running to win $10,000 cash as well. Have you saying win 10K here on your Better Living Afternoon. Great to have your company here on your Better Living Afternoon. Sarah Di Lorenzo is here for our Friday Arvo check-in. In lieu of you not calling through to get an assessment, I'm going to do it for you. I'm going to be the lab rat today. This is what an assessment is like, one of the many diagnostic tools at the fingertips of a clinical nutritionist. So, Sarah, you're going to do an iridology assessment, which is peering into the window of my soul, essentially, to run through a whole bunch of segments. What will you see? Are you looking for lack of sleep? That'll probably show up. That'll be the first thing.
Well, that would be in the sclera. So that's in the white part of the eyes, and they'll be looking maybe just for a little bit of redness around there.
Okay, so you got your little, it's like a little torch thing with a magnifying glass built in.
Yes, it is, yes.
And why don't we just go for it? Just call out what sort of segments you're looking for. If there's parasites, we've got an understanding. We won't say too much about that.
So you need to move closer to me.
Okay.
So when I look, we're looking in and look straight ahead.
Yep.
Okay. So you're very determined, Ed. I can see your personality. You've got very tight iris fibers. So I can look at that. You've got a strong constitution.
I feel like we need some accompanying music from Todd. I don't know what's appropriate to having your eyes looked at. Is there Hungry Eyes by Eric Carmen? I don't know. We'll find something. Yeah.
Okay. So looking straight ahead. Yep. So your cardiovascular system's fantastic. The sclera looks good. I'm looking at the sclera is the white part of the eye. You don't have any pterygiums, which can be sun damage.
Wow.
You're someone who can do. You're a 6 meal a day person.
Really?
You're better off with 6 meals than the stock standard breakfast, lunch, and dinner.
What shows that up in my eye? What's triggering you to that?
The wreath, the size of the wreath, the size of your wreath. Mm-hmm. You're going to recuperate well. You're going to your eye looks really healthy. I can't see any inflammation. Lymphatic system looks good. There is a few little just general freckling there, which is you've got a tiny. You would have been a blue-eyed baby. There's actually only the true eye colours. There's only actually blue and brown as natural eye colours, and then throughout life with different things we get what's called a heterochromia, which is a colour film that develops, and it can.
Eye of the tiger. Very good, Toto.
Oh, I love that.
Very good.
It's fantastic. So healthy eye, Ed. You're
freckling of the eye. What's
just a little freckles. There's tiny little spots on there, which
from
is
sun damage or something.
No, not just. It's just they're things that are there. There's nothing scary about them. But
wow.
Yeah, bowel
is left eye different to right eye?
Show me your right eye.
Here we go. We're switching eyes around. There might be another eye song.
Yeah, it's quite similar, but you've got a dominance of your parasympathetic nervous system. You're very much the perfectionist. Because I'm looking at your pupil size now, which is quite small. I can't see any nerve rings, which represents anxiety.
My pupil's small because you've got a bright light shining into it.
No, it's not, because I'm even looking. I've taken the light array now, and it's I can't see any parasites. I'm actually looking at a really healthy eye. Yep. So you would have been a real blue-eyed baby.
No parasites, everyone. No parasites.
There's nothing I can report that's scary in there.
It's the nicest thing you've ever said to me. No parasites.
You're just hooking onto the parasite
Well,
thing.
I picture some sort of little tsetse fly, from Africa, just infesting in the eyelashes or something or other.
I always recommend to people anyway that they should generally do a worming biannually.
What? I'll do that for the cat. Why am I doing that?
I just think they should just do it. People who travel a lot especially, sometimes they just a little bit of, a bit of maintenance. I always recommend that. Yeah.
Okay, so important things. Why does cardiovascular system show up as as some sort of marker in the eye as well? That's heart and lungs and veins.
Yeah, that's the external part. So that's the border. So I can see that if it's darker or if it's lighter, you can just look at your circulation, and your circulation's really good if it's nice and clear on the edges.
Yeah.
And if there's any kind of white little dots on the inside, that's lymphatic congestion, which is called a lymphatic rosary.
Right.
So it's just such a great, it's such a fantastic tool for me.
Amazing.
To really make sure that I'm giving these people the best program that I can give them.
But how fascinating is the body in that it'll show these things if you know how to read the signs as well for a little quick analysis? Amazing.
The human body is amazing. And can I just say something else about the human body? One thing I just love. At the end of my consultations, I give people a treatment plan. So at the end of this big consultation, they will walk away with the treatment plan. And the treatment plan will generally be, it's there. I look at people completely as individuals. And at the end of it, not one of my patients would be on the same program because everyone's different, as you've just seen with me talking about your iris. But when we look at the human body, and part of my treatment plan is, first of all, the first section of it would be supplements. But when I do my dietary recommendations, whatever it is for whatever condition it is, I always refer to food. And this is what's amazing about nutritional medicine and food. If you look at things like, if people have got issues with vision, you look at a carrot. A carrot actually, if you could do a cross-section of a carrot, it actually looks like an eye.
Oh, okay.
If people have issues with, and so I bring food in as much as possible. It's everywhere I can, I'll bring food in. If you have a look at a capsicum, and if we were to do a cross-section of a capsicum, it's got 4 chambers in it, just like the heart. So and then if you look at celery, it's good for the bone. It looks like the bone. If you look at an avocado, it looks like a womb, and it's actually 3 avocados a week will get any woman through a fantastic childbirth. If you look at tomato, it's good for the heart. If you look at ginger, the shape of ginger, and ginger's actually anti-nausea. It's the same shape as the stomach.
Is it?
Yes, and if you look at a pancreas and then you look at a sweet potato, they're the same shape. And a pancreas is actually really highly indicated for, it's for the pancreas. And then walnuts, brains. Okay, so if you look at breast tissue, if you looked at a cross-section of a grapefruit, red wine, resveratrol, antioxidants, blood. I bring all those things in.
It's like a puppet show. It's fantastic.
How good is food, though?
Yeah.
Food is medicine.
Clever.
Medicine is,
very, very clever.
Food is medicine.
Now, you said to me nicely, I look like I could also be a bit of a worrier. You can show that up in your eyes. What do you do for that to ease sort of worry levels and stress levels?
If someone, definitely. Look, I'm sitting here as the daughter of a psychiatrist. So
Are you?
It's quite the whole thing. So when I go through people's anatomical systems, which is part of my interview process of the initial section of the consultation, one of the questions I'll talk about is people's mood. So for me, worrying and anxiety, they're linked. Well, that's the nervous system. So with the nervous system, you can look at, I would think B vitamin deficiency. Depression, I would think vitamin D deficiency. So anyone who's got any kind of anxiety, they would have to address their B vitamins and have a look at supporting their nervous system.
Wow. Daughter of a psychiatrist tells me so much more. That's my diagnostic tool. Tell me about your parents.
Well, this is another thing. So I always start, one part of the beginning of my consultation will be tell me a bit about family history. So just to make that quick and easy, I always just say to the patients, snapshot of mum and dad, medications and diseases. And I can honestly tell you that people who have living parents that are old enough, or probably my age group or younger, all of their parents, and this does alarm me, are anywhere 70 and above are on medication.
Yeah, right.
And they have diseases. And if you see a nutritionist and you sort of nip all this in the bud around, your 40s, you'll avoid all those diseases that just plague us today, which are reversible things like metabolic syndrome, diabetes, etc.
Yeah, right.
Yes.
Fascinating stuff. What a great insight into what goes on in an initial consult. If you're thinking about it, I think you're probably more motivated now. People can do consult with you, if not in the Sydney region, maybe just some discussions online as well?
I have people overseas as well. So I have people all over the place. Yeah, no, I do Skype sessions.
Yeah, great.
So, yeah, I do weight loss on Skype. I will sometimes FaceTime or Skype. Yeah, I do actually quite a lot of those. And for people who can't travel and for people who are obese or whatever, who can't get there, I've got stairs to my clinic, so people who can't get upstairs. And if people are local, I'll go and see them as well.
Yeah. And if people want to do a FaceTime and stick their iris right up by that camera,
I'll do that.
way.
Absolutely.
Can you seriously?
I have done that before. Yes, I have got them to.
clever.
I've actually got them to take a photo of it.
And
send me a photo as best as they can.
Yeah.
Yeah.
There we go. Fascinating stuff, Sarah.
It's so
great
good,
consult.
isn't it?
I feel good.
Great.
If not somewhat fidgety, but that's probably just because I've had these bright lights boring into my skull. Beautiful.
Fantastic.
Thanks so much for the consult.
My pleasure.
If people want to
Absolutely.
find out more, sdlmethod.com, and that'll take you straight to Sarah Di Lorenzo. Happy Fridays. We'll see you next week.
Happy Friday.